When a child presents with a psychological issue, the symptoms rarely stem from just a single, isolated variable. To accurately map a diagnosis, we rely on the ecological model developed by Yuri Bronfenbrenner. At the center of this architecture is the proximal core, the immediate forces interacting daily with the child, such as parenting dynamics and sibling relationships. Surrounding this core are distal pressures. These are macro-level factors, like socioeconomic status, neighborhood environments, and broader cultural expectations. These layers do not exist independently. Distal sociocultural factors and proximal family dynamics operate in a state of continuous modulation, constantly altering one another over time. Because of this continuous feedback, identifying a localized symptom without mapping its surrounding ecological context yields an incomplete and often useless clinical picture. Within that proximal core, clinical models traditionally viewed family influence as a top-down vector where parents shape a largely passive child. The reality is governed by bidirectionality. Children actively construct the environments and relationships they experience. A child's inherited genetic characteristics and innate temperamental style physically alter the dynamic of the entire family system. An easily dysregulated infant, for example, directly evokes different and often more strained responses from caregivers compared to a placid, easily soothed infant. These mutual feedback loops begin immediately, locking into place during the earliest stages of neurobiological regulation and infant attachment. Nature and nurture act as a co-created system where each force defines the other. To evaluate how these structures fail, we examine the most critical proximal influence, the parent-child dyad. This chart shows the clinical assessment of parenting, relying on a 2x2 matrix to track two central dimensions: involvement, or responsiveness, on the y-axis, and demandingness, or control, on the x-axis. The vertical axis measures a caregiver's warmth, emotional availability, and positive engagement. The horizontal axis measures structure, behavioral monitoring, clear expectations, and active behavior management. Authoritative parenting, which scores high on both axes, consistently serves as the most robust predictor for a child's positive self-regulation, emotional control, and peer relationships. When parenting is compromised, developmental risks multiply. These risks cluster into four specific deficits: discordant family relationships, a lack of parental warmth, harsh or inconsistent discipline, and poor monitoring. Underlying parental mental health problems often act as the mechanical inhibitor here. Maternal depression, for instance, actively reduces responsiveness to infants and increases negative interactions with older children. Evidence-based family interventions and parenting programs are specifically designed to target these compromised quadrants, deliberately working to reestablish both behavioral control and dyadic warmth. Alongside parents, siblings form the rest of the immediate domestic system. The sibling dynamic is often the longest-lasting and most emotionally intense relationship in a child's development. This image highlights recent clinical findings regarding sibling dynamics. Notice the third point. High conflict between siblings is no longer regarded as inherently pathological, but rather a normative feature of the relationship. However, as the text notes, there is a direct correlation between sibling bullying at home and an increased vulnerability to peer victimization at school. The image also points out a critical clinical upside. A warm sibling relationship provides a powerful protective buffer for children growing up amid high marital conflict or facing severe negative life events. Despite sharing the same household, siblings often exhibit vastly different adjustment and personality outcomes. The divergence is driven by differential parental treatment and unique, non-shared experiences both inside and outside the home. Each sibling effectively inhabits a slightly different version of the same family. Because siblings drive early social understanding, a psychiatric assessment that ignores the granular details of their dynamic is structurally incomplete. Moving one ring outward in the ecological model, we encounter institutional contexts, early childcare, and formal schooling. In modern Western societies, nearly half of all infants experience significant non-maternal care before they reach 1 year of age. Clinical evaluation of this care splits into two distinct metrics: the quality of the environment versus the raw quantity of hours spent there. High-quality care, defined by sensitive caregiving and rigorous cognitive stimulation, yields lasting developmental benefits in both language acquisition and prosocial behaviors. Conversely, a high quantity of care, meaning excessive hours spent in non-maternal settings during that critical first year, correlates with a slightly increased risk of childhood disobedience and behavioral issues. As children transition to formal schooling, the school's social and organizational climate becomes a systemic variable. This environment impacts a child's academic progress and behavior entirely independent of their individual traits. Schools that produce the most positive outcomes share clear organizational hallmarks: purposeful leadership, constructive classroom management, and consistent but crucially non-severe disciplinary sanctions. Within these halls, peer dynamics wield severe influence. School bullying acts as an independent risk factor for later adjustment problems, rather than simply presenting as a symptom of a child's pre-existing anxiety. These institutional settings do not operate in a vacuum. They interact directly with the child's baseline temperament, acting as mechanisms that can either mitigate or exacerbate early family risks. Stepping to the outermost rings of our model, we confront distal pressures: neighborhood context, socioeconomic status, and daily material circumstances. These pressures frequently materialize through severe structural transitions within the home, such as parental separation or divorce. A parental split is seldom the primary driver of developmental risk. Instead, the child's environment is destabilized by a cascade of economic decline, residential moves, and the loss of established social networks. This flow diagram maps a mediating pathway, allowing us to trace how macro-level factors like severe economic disadvantage actually reach the child. Persistent poverty rarely acts directly on a young child's psychology. Instead, it imposes severe, unyielding stress on the parents. That acute parental distress degrades baseline parenting capacity. It strips away patience and responsiveness, leading to compromised practices like harsh or inconsistent discipline, which in turn triggers externalizing behavioral issues in the child. Treating a child's behavioral problems requires acknowledging this mechanical, downward pressure. The structural disadvantage actively suppresses the family system's ability to cope. When adverse risks emerge across a child's personal temperament, parenting, peer groups, and sociocultural environment, they do not operate in isolation. They compound. The total number of systemic risks a child faces simultaneously explains a massive portion of the variance in their final developmental outcomes. This brings us to the advanced clinical concept of risk configurations. We now know that specific combinations of these ecological variables predictably result in highly specific clinical presentations, dictating whether a child develops an internalizing disorder, like anxiety, or an externalizing disorder, like conduct disruption. The impact of a distal stressor, like poverty, changes entirely depending on the precise configuration of proximal buffers, such as the presence of an authoritative parent or a highly supportive older sibling. Formulating a diagnosis based on a single variable or an isolated trauma ignores the mechanical reality of how cumulative systemic risk actually functions in a developing brain. In practice, effective clinical intervention relies on meticulously mapping the individual patient onto this comprehensive ecological framework. Attempting to treat a localized symptom, like simply prescribing medication for a child's disruptive behavior, without simultaneously addressing the underlying environmental cascade, is a recipe for clinical failure. Interventions like cognitive behavioral therapy, targeted parenting programs, and systemic family therapy are not generic cures. They are specialized tools designed to repair specific, disrupted nodes within the child's unique ecology. Clinicians must always account for bidirectionality during treatment. The child will actively react to, push against, and shape the intervention itself. To truly promote a child's well-being, we have to look past the isolated patient in the examination room. We must understand them as an active, embedded participant in a complex, multi-layered world.